Hello and welcome to my channel. Today I am going to explain about the MRCS Part B. So this video is the basic orientation video regarding the MRCS Part B. So MRCS Part B is one of the final exams which is required to get or complete the membership of Royal Colleges of Surgeons of Great Britain and the Ireland. So it assesses whether you are ready to move from the core surgical training into the specialist training of your field or your choice. Once you are done with MRCS Part A as well as MRCS Part B, you will be awarded this postgraduate MRCS diploma. So now we will talk about the details which you need to know before starting the preparation. So first of all, we have the exam structure. So it is very important to understand that what is the format and what specifically things are there which you need to tackle to pass this exam. So it is an OSCE based exam, which is the objectively structured clinical examination. It has in total 17 stations. Each station lasts about 9 minutes and it has total about 3.5 to 4 hours. So let me explain all this stuff through a diagram to have a better understanding about the exam format and how to focus on specific areas. So I have made this flowchart to get you a better understanding about the MRCS Part B. MRCS Part B exam is divided into knowledge as well as skill stations. The knowledge station is going to test your knowledge for the anatomy section, critical care and surgical pathology. Whereas in skill section, you're going to be tested on basis of your communication skills, your history taking skills, your clinical examination, and some procedural skills. So you're going to get 3 anatomy stations, 3 critical care stations, 2 surgical pathology stations. In the skill section, there is only 3 stations from the clinical examination, while the procedural skills, history, and communication each is going to have 2 stations in each. Now, what happens is that there are 9 minutes for each station and there is 1 minute to read the stem, and there is also 1 minute that has been allocated by the college for you to move from one station to another. So you do not have to worry. It is a very clinically structured and well organized exam. So if the bell is and there is one important thing, that especially for these stations, you are required to know that when the station is going to end. So they have additionally added a bell which is rung at 6 minutes so that you can get an idea that either you have to speed up or your base is already perfect for the communication, history or examination stations. So once you're aware that you have to focus on all these stations, then you pick on each of them and start working hard. And the most important thing to pass MRCS is to do it again and again and again and try to have a partner. If not, then try to take some mocks. They are going to be really helpful because confidence is going to be the main key player in order to get you through the exam. So now we will talk about the eligibility criteria. So to sit the Part B exam, you must have cleared MRCS Part A. It does not matter from which college you have cleared your exam, you are going to be eligible for MRCS Part B. You should have a recognized medical degree, which is actually the prerequisite to get your MRCS Part A. So there is only one requirement, that you have passed your MRCS Part A. And you need to submit an authorized degree which you once have already done for the Part A. So it is just a repetitive step which you do when you apply for MRCS Part B. So you have total of 4 attempts within 7 years of passing your MRCS Part A. So it is best that you try to book your seat as soon as possible you have passed your Part A exam. So what is really assessed in these stations? You're going to get anatomy and pathology stations, critical care and surgical science stations, clinical and procedural skills, and communication skills. So it is a multi-dimensional exam because you're not only going to study whole body's anatomy, we should also be knowing head to toe all the examinations which a clinical doctor should be knowing. Then On the other end, you will be tested for the pathology. That include most of the carcinomas. You need to know their TNM staging. You need to know the specific stains, and you need to know a bit more detail. Then on the other end, you should also be good in your communication skill, because you're going to be tested for two stations. One is going to be a communication with the colleague, where you will be sharing your case notes with your colleague. But the second communication station will be with an actual patient, or it would be a attendant to whom you will have to explain a clinical scenario. So you have to practice a lot. Now, the important thing is that each station is tested out of 20 marks, and there is the borderline regression method, which determines the overall pass mark criteria. So how can you apply? So you can apply through any of the 4 Royal Colleges, which includes the Royal College of Surgeons of England, Edinburgh, Glasgow, or Ireland. All of them have same exact content, the same level of difficulty. So you do not need to worry that one college is going to conduct a more difficult exam or the other is going to conduct a lenient exam. Everything is mediated through an intercollegiate committee. And in your exam, even a member from the Royal Colleges that you have picked and one member from the other Royal College would also be present to check for the transparency of the exam. So it is very structured exam. So regarding the exam dates and location, exam is held in the UK, Ireland, as well as in international centers, which includes Pakistan, India, Malaysia, Bahrain, Egypt, Singapore, and many more. Now, it is usually held from January to October, and unlike the MRCS Part A, which is very clearly listed on the the Royal College of Surgeons website, that it is going to be conducted in this month, in this date. But regarding MRCS Part D, you have to be very much vigilant because of the recent advances that everyone is booking their exam very fast. So you have to be on your feet to get your seat booked in the right time, because the seats are announced more than 3 months before the exam. So if you have passed your exam, try to be connected to a mock exam course or any course so that you do have enough time, because 3 months is a bit of less time. You need at least 4 to 6 months of practice to get through this exam. So once you are done with your exam, you will be eligible to get your GMC registration and have a license to practice, and you can work as a doctor in the NHS. Either you get a non-training job or a training job. So regarding the scoring and results, it is based on the structured mark sheet where you're rated against pass, borderline, or fail. So final result is based on the station level marks and the overall performance of the candidate. Now regarding the exam difficulty, MRCS Part B is a challenging exam because you have to perform well and you have to perform within a specific time duration. You not only have to be on edge for your anatomy knowledge, but you would also be very much aware that you have to be fluent in your English. But fortunately, it has much higher passing rate than MRCS Part A. And the thing is that you have 4 attempts, and you should definitely be booking your exam as soon as you get your MRCS Part A passing certificate. Now, the key to passing this exam is that you should be aware that on what basis the exam is conducted and the examiner is asking you for what. So you need to understand and examine the algorithm which you need to follow in each of the stations, because there's going to be different set of practice which you have to do to pass your anatomy stations, and you have to follow a different set of pattern in order to get through your communication, your examination. So it is a technically difficult exam, but the key is to get a study partner or join any mock exam which is available near you and get connected with that academy and start doing your mocks, because the more you do the mocks, the more confident you are going to be on your exam day. So, at the exam, in some areas of the world, either there is going to be a real, or in some part there are simulated patients present, but examiners are always present in the station. It is less likely that you would be tested through a examiner that is present only through a net or like Zoom or something. Now, there could be a clinical setup where you will be getting your exam conducted. They are usually very well structured and internationally accepted areas which are used as centers. So it is going to be a very comfortable area which will be provided to you on the test center. So you do not have to worry about that. Now, regarding the cost, MRCS Part A costs around £607, but MRCS Part B is around £1,099. Now, the thing is that there are some books and materials, question bank, mock courses, and traveling. You have to keep these points in mind when you're getting your budget managed for MRCS Part B. So, for how long you should prepare for the exam? It typically requires around 4 to 6 months, especially when you are working. And you should always get a mock exam, or you should definitely be working in a group of your fellows, or at least have one person to whom you can read through all the stations, so that you're so much perfect in all your stations that on the exam day, whatever the question is, you bring the answer right away. So mock exams are conducted by various academies. So it is up to you that which course you want to take. They all are well structured, and definitely they all work in collaboration with the standards which are required to pass the exam. So I have talked about this, that it is better to get your MRCS Part B book soon after you're passing MRCS Part A. So my final advice to all the MRCS Part B aspirants would be that it is a practically high-staking exam. So you need to study smart and practice regularly and work on your communication. So communication, taking mocks, and practice are going to be your key points which you need to work on every day. And please do not hesitate to join any study group or revision course that you want to join. I have made a group. I will add the link in description. You can join my course or you can take any other course, but it is highly recommended to have a course, because without practice, it is very difficult to pass MRCS Part B. So best of luck for your journey. If you have any queries, just DM me or write in the comment sections. I will try to answer your comments. Thank you very much for watching this video.